Welcome to our NCLEX Practice Test. This test has 75 questions on topics you'll see in the real exam. These questions will help you better understand the concepts that will be tested on the exam. Let's get started. 1. The duodenum, A, is the third section of the small intestine, which leads immediately to the colon. B is the section of the stomach where the gallbladder delivers bile. C is the section of the small intestine where the pancreas delivers insulin. D. None of the above. Correct answer, D. None of the above. The duodenum is the first part of the small intestine where the majority of digestion takes place in the gut. The gallbladder and pancreas will deliver its digestive juices to this section of the small intestine. The pancreas will deliver amylase and lipase while the gallbladder will deliver bile. 2. The flap of tissue that covers the trachea upon swallowing is called the A. Epidermis, B. Endocardium, C. Epiglottis, D. Epistaxis. Correct answer, C. Epiglottis. The epiglottis is a flap of tissue that covers the windpipe upon swallowing to protect the respiratory system from becoming blocked by food or liquid products. 3. Which of the following symptoms is a presumptive indication of pregnancy? A. Auscultation of fetal heart tones. B. A positive home pregnancy test. C. Amenorrhea. D. Ballottement. Correct answer, C. Amenorrhea. Presumptive pregnancy indications are those symptoms that may be associated with pregnancy but do not actually confirm a pregnancy. Presumptive symptoms may all be associated with other conditions beyond pregnancy. Amenorrhea, while often caused by pregnancy, may also be due to other conditions, such as illness or increased exercise. Amenorrhea is only a presumptive symptom and does not confirm a true pregnancy. 4. A client is being seen for confirmation of pregnancy. She states her last menstrual period was June 2nd. According to Naegele's rule, what is this client's estimated due date, EDD? A. April 2nd. B. March 9th. C. February 2nd. D. February 19th. Correct answer, B. March 9th. Naegele's rule is a system of calculating a woman's estimated due date of pregnancy based on her last menstrual period. After determining the first day of the last menstrual period, count backward 3 months. Then, add 1 year and 7 days to the date to determine the EDD. For example, 3 months prior to June 2nd would be March 2nd. 7 days following this date results in an EDD of March 9th. 5. A nurse attends the delivery of a full-term infant. After the infant is delivered, she carries him to the warmer and dries him off. His heart rate is 120 BPM, his body is flexed with good muscle tone, his hands and feet are blue while the rest of his body is pink, and he starts to cry when stimulated. Which of the following is the most appropriate APGAR score for this infant? A. 10. B. 9. C. 6. D. 4. Correct answer, B. 9. The APGAR score is a method of quickly evaluating an infant immediately following birth. The score is based on characteristics of the infant's behavior and appearance and guides the nurse as to interventions that may be necessary. Scores are assigned from 0 to 2 based on heart rate, respiratory effort, muscle tone, reflex, and color. This infant scored 2 points for all of the above except color, as he had acrocyanosis in the hands and feet. Removing 1 point for this characteristic, this infant scored a 9. 6. A nurse is caring for a woman who just had a baby 6 hours ago. The nurse is concerned because the mother seems more interested in letting her husband care for the baby. Which of Rubin's puerperal phases is this mother exhibiting? A. Taking in phase. B. Taking hold phase. C. Letting go phase. D. Handing off phase. Correct answer, taking in phase. Shortly after birth, a woman may go through certain phases that help her to identify herself in her new role as a mother. During the taking-in phase, the mother is often focused primarily on her own needs. She may often let a spouse or partner take over care of the infant. 7. A nurse is performing a birth assessment on an infant who was born 1 hour ago. During her assessment, she strokes the sole of the infant's foot from the heel up toward the toes and notices that the toes flare as a response. Which test is this nurse performing? A. Tonic neck reflex. B. Startle reflex. C. Babinski reflex. D. Morrow reflex. Correct answer, C. Babinski reflex. The Babinski reflex is performed on newborn infants and children up to 2 years to assess for central nervous system deficits. A normal response in a newborn includes fanning of the toes when the sole of the foot is stroked from the heel toward the toes. No response to this stimulation indicates a problem with the central nervous system. 8. A sexually active client asks the nurse for information about contraception. The client is interested in an intrauterine device as a form of birth control. Which of the following is an advantage of an intrauterine device? A. It protects against sexually transmitted infections. B. It can be inserted several hours before intercourse. C. It is acceptable to most religious backgrounds. D. It remains in place at all times. Correct answer, D. It remains in place at all times. An intrauterine device is a form of contraception that is inserted into the uterus by a physician. This device protects against pregnancy and remains in place at all times, giving a woman more freedom over contraception. Intrauterine devices do not protect against sexually transmitted infections and may not be accepted by all religious backgrounds. 9. Which of the following best describes the cognitive development of an 18-month-old child? A. The child can follow one-part directions. B. The child understands the concept of forever. C. The child can name 6 body parts. D. The child has an attention span of approximately 5 minutes. Correct answer, A. The child can follow one-part directions. An 18-month-old child's level of cognitive development allows him to follow one-part directions from others. Children who are this age observe and imitate the behavior of others and thoroughly explore their environments out of curiosity. Although an 18-month-old child is starting to remember the place or location of objects, his attention span is very short. 10. A nurse is assessing pain response in a 9-month-old child. She uses the CRIES scale to determine if he is having pain. The I in the CRIES scale stands for A. Informal response. B. Increased reflexes. C. Immediate reaction. D. Increased vital signs. Correct answer, D. Increased vital signs. The I in the CRIES scale stands for increased vital signs. The CRIES scale is often used among infants who cannot use words to describe their pain. Signs of pain may include crying, increased heart rate or blood pressure, and grimacing. A nurse can use the CRIES scale to rate an infant's pain in order to provide pain control measures. 11. All of the following are essential components of supervision except A. All tasks to be delegated or supervised are within the nurse's scope of practice. B. The necessary tasks require repeated assessments. C. The nurse has adequate time to develop staff assignments. D. Policies have been developed that govern nursing practice. Correct answer, B. The necessary tasks require repeated assessments. Nursing supervision of staff requires several components that must be in place in order for the nurse to provide adequate management. The nursing actions should fall within the nursing scope of practice and should be governed by the appropriate policies. Adequate staff must be available to perform the necessary work, but each task should not require repeated assessments to be completed. Repeating assessments negates the need for delegation when the nurse must follow through on the delegated work. 12. Which of the following is an example of a breach to a client's right to privacy? A. A nurse who is not caring for the client reads his personal information in his chart. B. A client is not allowed to keep a copy of his original medical record. C. A nurse filed an incident report about a client that was reviewed with all staff at a meeting. D. A client's photograph was used without permission. For the hospital newsletter. Correct answer, D. A client's photograph was used without permission for the hospital newsletter. A client's right to privacy includes his right to receive treatment without interfering with his personal information in a manner that is above and beyond reasonable levels. This includes a client's right to be left alone during his care. Photographs, information about the client's name or background, or otherwise encroaching on a client's private information are all breaches of privacy if not given permission. 13. Which of the following abides by the Americans with Disabilities Act of 1990? A. A nurse is allowed to have a leave of absence to recover after a back injury. B. A nurse manager cannot cancel an interview with a potential employee because he has left-sided paralysis. C. A nurse is mandated to receive 12 weeks off of work after having a baby. D. A nurse manager must hire a nurse who uses a walker for mobility. Correct answer, B. The nurse manager cannot cancel an interview with a potential employee because he has left-sided paralysis. The Americans with Disabilities Act of 1990 provides accommodation for persons with disabilities in that employers cannot discriminate against a person because he is disabled. The Act protects the application and employment process of people with disabilities. While a nurse manager cannot discriminate against someone for having a disability by failing to interview, this Act does not require employers to hire a person with a disability if he is not qualified. 14. A patient that is post-op day 3 from a total knee replacement informs the nurse that he lives alone and has 2 sets of stairs in his home. The following action taken by the nurse would be appropriate after gathering the above information. A. Notify the physician. B. Notify the social worker. C. Arrange for a family member of the patient to stay with the patient. D. All of the above. Correct answer, B. Notify the social worker. The nurse has the responsibility to make a referral to a social worker following this interaction with a patient. It would be unsafe for the patient to be discharged to home without any assistance. The social worker will be able to further assist in the discharge process according to the patient's needs and insurance coverage. 15. Because of budget cuts in the hospital, the nursing manager informs the staff that they must either float to other units more often or take their turn staying home from work. Which principle is this nurse manager demonstrating? A. Justice. B. Paternalism. C. Veracity. D. Fraternity. Correct answer, C. Veracity. Veracity involves truth-telling, even when the situation is difficult. Staff nurses have a right to know if their shifts will be changing, which may eventually affect their pay or the areas in which they will be expected to work. The nurse manager is demonstrating veracity by giving them notice of the upcoming changes. 16. A new nursing unit is opening in the hospital. In order to meet the staffing needs of the unit, nurses from other areas will be moved and required to work in the new area. When notifying the nurses chosen to staff this area, the nurse manager states, "You will either move to work on this unit or you will no longer be employed at this hospital." Which of the following strategies is this nurse manager using? A. Manipulation. B. Facilitation. C. Co-optation. D. Coercion. Correct answer, D. Coercion. This nurse manager is using a coercion tactic to convince nurses of their job changes. Coercion involves using power to force others to make a choice. In this example, the nurses must choose to work on the new unit or they will lose their jobs. 17. A group of nurses who work on the Quality Assurance Council of a unit have gathered to discuss ideas about how to educate their co-workers about Joint Commission requirements. Each of the nurses gives ideas, which are listed together without initially criticizing any of the suggestions. Eventually, all ideas on the list will be discussed as to their validity. This activity is known as A. Optimizing, B. Satisficing, C. Brainstorming, D. Centralizing. Correct answer, C. Brainstorming. Brainstorming occurs when members of a group throw out ideas for possible solutions. The ideas are not initially discussed or criticized as being valid or convincing, they are instead listed together as a collection of thoughts or plans. Once all ideas have been suggested, the team can then discuss the practicality of implementing some of the ideas. 18. An assisted living facility is an example of which type of healthcare provider? A. Primary care, B. Secondary care, C. Tertiary care, D. None of the above. Correct answer, C. Tertiary care. An assisted living facility is an example of a tertiary care provider. A tertiary care provider is one that provides rehabilitation or long-term care after a client has practiced prevention of illness or has been treated for disease. 19. Which of the following statements is true regarding nonprofit organizations? A. They are located in poor or rural areas to provide care to the largest number of people. B. They are mandated to care for people, even if clients are unable to pay for services. C. The money they receive for services is divided among stockholders that have invested in the organization. D. They are also called proprietary organizations. Correct answer, B. They are mandated to care for people, even if clients are unable to pay for services. Nonprofit organizations are those that return the money they receive from clients into their own business in order to develop further services. Nonprofit organizations may be located in any areas, but if their services involve care of others, they are required to provide care regardless of whether the client can pay. There are many hospitals, community clinics, and healthcare educational organizations that are considered nonprofit. 20. Which of the following is a function of risk? Management. A. To consider the problems that arise if errors happen and their effect on the healthcare environment. B. To identify how nursing care responds to specific client problems. C. To view clients as customers and decide what actions will provide a satisfying healthcare experience. D. To analyze physician-nurse relationships and determine where collaboration efforts can improve. Correct answer, A. To consider the problems that arise if errors happen and their effect on the healthcare environment. The risk management department of a healthcare organization looks at potential losses and how they could negatively impact the organization. The department also works to implement strategies that will minimize these losses, thereby providing cost savings to the organization as a whole. While not all nurses will work specifically within the risk management department, all nurses play a role in risk management by monitoring their own work to minimize losses in each of their own areas. 21. Which of the following is an example of effective time management? A. Always agreeing to others' requests for help. B. Arranging long meetings to discuss important data. C. Using multiple forms of technology to communicate or educate others. D. Working in a secluded area to minimize interruptions. Correct answer, D. Working in a secluded area to minimize interruptions. Effective time management skills are essential to accomplishing daily goals and providing adequate care for clients without becoming overwhelmed. Time management practices may be as simple as working in an isolated area to chart or catch up on paperwork in order to avoid becoming distracted or being interrupted. Responding to all requests for help, arranging long meetings, and submitting to information overload through various forms of technology all contribute to ineffective time management. 22. Which of these clients is the best candidate for using patient-controlled analgesia? A. An 86-year-old man in the memory disorders unit. B. A 6-year-old boy with a tibia fibula fracture. C. A 56-year-old man post-op day number 1 after a hernia repair. D. A 70-year-old woman with end-stage brain cancer. Correct answer. C. A 56-year-old man post-op day number 1 after a hernia repair. Patient-controlled analgesia, PCA, is a method of pain control that gives the client more freedom with managing his own pain. He can self-administer pain medications without waiting to ask the nurse. Some clients, however, are not good candidates for PCA in that they may not understand how to self-regulate their pain control, or they may not remember to push the button. Those with memory disorders, those in the late stages of terminal illness who may have disorientation, and children are not good candidates for PCA. 23. Which of the following clients is most likely to benefit from receiving a peripheral nerve block? A. A client undergoing a cesarean section. B. A client undergoing an appendectomy. C. A client undergoing a cervical discectomy. D. A client undergoing a total knee replacement. Correct answer. D. A client undergoing a total knee replacement. A peripheral nerve block is a type of anesthetic that involves blocking the sensation of a particular nerve in the arm or leg. This type of anesthesia is useful for clients who are undergoing a procedure that affects only one body part. Clients may or may not need general anesthesia with this procedure, but it offers pain control and diminished sensation to the affected area. An example of a procedure that uses a peripheral nerve block is a total knee replacement. 24. A nurse has been given an order for a 20 cubic centimeters bolus to a client with a central line. The only syringes she has available are 5 or 10 cubic centimeters in size. What is the most appropriate action of the nurse? A. Give 4 boluses of 5 cubic centimeters each. B. Give 2 boluses of 10 cubic centimeters each. C. Find a 20 cubic centimeter syringe. D. Either B or C. Correct answer. D. Either B or C. When administering small amounts of fluid through a central line, such as with a medication or giving a bolus, the nurse must use a minimum size syringe of 10 cubic centimeters. A syringe of a smaller size may place too high of pressure on the internal catheter. In this situation, the nurse could either split the bolus into 2 10 cubic centimeters injections, or find a 20 cubic centimeter syringe to use for this purpose. 25. Mr. L is in the emergency room with a traumatic amputation. The physician determines that he needs a rapid infusion of packed red cells. Mr. L is unconscious and the nurse does not know his blood type. Which of the following blood types might be the safest to use in this situation? A. Type A-. B. Type AB+. C. Type B-. D. Type O-. Correct answer. D. Type O-. Type O negative blood is considered a universal donor type and may be used in cases when a client's blood type is not immediately available. Type O negative blood is compatible with all blood types because it does not contain any antigen markers. Although type O negative blood can be used in emergencies, it is preferable to establish a client's blood type prior to administering blood, if possible. 26. Which of the following describes a benefit of using a Grashong tunneled catheter? A. It does not require regular heparin flushes. B. It is less prone to kinks in the line when compared with other central catheters. C. It can easily be placed at the bedside by a certified nurse. D. It does not require an X-ray to confirm placement. Correct answer. A. It does not require regular heparin flushes. One of the advantages of a Grashong catheter is that it is constructed so that it does not require heparin for flushes. Instead, the nurse may use a normal saline flush per facility protocol. A Grashong catheter is typically inserted by a physician in an operating suite and its placement must be confirmed by X-ray before use. 27. Which of the following interventions should the nurse perform when changing a cap on a central line catheter? A. Open the supplies just before starting. B. Unclamp the catheter. C. Cleanse the catheter cap with povidone iodine. D. Change each lumen on different days of the week. Correct answer. A. Open the supplies just before starting. Changing a cap on a central line introduces the possibility of infection into the client's body and should be performed carefully. The nurse can reduce the chance of infection by opening supplies just before starting. Although the nurse will want to have supplies ready for use, opening packages early and leaving them to sit in the work area may increase the risk of introducing infectious particles to the client. 28. A nurse is caring for a 5-year-old child who just had an appendectomy. The physician wrote orders regarding pain control, diet, and fluid administration. The nurse reads the order that says, maintain 4D5W at a rate of 500 cubic centimeters per hour. What is the most appropriate action of the nurse in this situation? A. Administer the fluid at the prescribed rate. B. Take the client's blood pressure before changing the flow rate. C. Administer the fluid at 50 cc/HR instead. D. Contact the physician for clarification of orders. Correct answer, D. Contact the physician for clarification of orders. When administering 4 fluids and medications, the nurse should be familiar with reasonable rates of administration. There are some clients who need large amounts of fluid, while among other clients, too much fluid can be dangerous. A nurse caring for a young child who has been given this order should clarify with the physician, as the prescribed rate is very high to give to a child. 29. A nurse is teaching a client to care for a Broviac catheter at home. Which statement from the client indicates understanding of the teaching? A. I don't need to wash my hands unless they are visibly soiled. B. If there is drainage at the insertion site, I should notify my physician. C. I should wash my hands after I take off the old dressing. D. I should use either rubbing alcohol or water to clean the end of the catheter. Correct answer, C. I should wash my hands after I take off the old dressing. Some clients care for tunneled catheters in their homes and the nurse is responsible for their teaching. A client with a Broviac catheter should be taught to look for signs of infection, how to change dressings, and how to flush the line. When performing a dressing change, a client demonstrates understanding if he knows to wash his hands between touching the soiled dressing and adding the clean one. 30. Which of the following actions should the nurse consider when working with a multi-dose medication vial? A. Discard the vial after 2 uses. B. Clean the stopper with 70% alcohol before each use. C. Puncture the vial with only 1 needle and connect multiple syringes. D. All of the above. Correct answer, B. Clean the stopper with 70% alcohol before each use. Multi-dose vials of medication can potentially increase the risk for infection if used improperly. Most facilities have policies regarding their use and labeling for when these vials become outdated. Because the multi-dose vial stopper may be punctured multiple times with different needles, the nurse can reduce the chance of infection by cleaning the stopper with an alcohol swab before puncturing. 31. What common drug can be administered to treat wheezing in a patient with infectious pneumonitis? A. Dexamethasone. B. Ibuprofen. C. Albuterol. D. None of the above. Correct answer, C. Albuterol. Albuterol is a beta-adrenergic stimulant that can be used to treat wheezing caused by obstructive lung disease. Albuterol works by relaxing muscles in the airways to increase airflow to the lungs. 32. A doctor writes out a prescription for medication to be taken as needed for pain. Which of the following abbreviations could the nurse expect to see on the prescription form? A. CHF. B. ATB. C. AC. D. PRN. Correct answer, D. PRN. The abbreviation PRN is used to indicate as needed. It is commonly found on prescription sheets that are used to fill a medication order for pain medications. 33. Mrs. H has been diagnosed with multiple myeloma. Based on the risk factors associated with this condition, which of the following background information is most likely true for Mrs. H? A. Mrs. H is younger than 30 years old. B. Mrs. H has a BMI of 31. C. Mrs. H is Caucasian. D. Mrs. H has 4 children. Correct answer, B. Mrs. H has a BMI of 31. Multiple myeloma is a type of cancer that develops within plasma cells in the bone marrow. Clients with multiple myeloma develop plasma cell tumors that may occur throughout the body. Those at risk of developing this condition are clients who are older than 40 years and clients who are overweight or obese. A client with a body mass index, BMI, of greater than 30 is considered obese. If Mrs. H has a BMI of 31, she may be at a greater risk of multiple myeloma. 34. Based on Mrs. H's diagnosis, which of the following complications is she most likely to develop? A. Anemia. B. Hyperlipidemia. C. Cirrhosis. D. Stroke. Correct answer, A. Anemia. A client with multiple myeloma is at risk of anemia when increased cancerous cells replace red blood cells. Other complications associated with multiple myeloma include decreased immunity, decreased renal function, osteoporosis, and increased fractures. 35. An 80-year-old patient is admitted with dyspnea, dependent edema, rales, and distended neck veins. As the nurse monitors the patient, he becomes increasingly short of breath and begins to have cardiac dysrhythmias. The most critical intervention for this patient is to A. Ensure his airway is open and unobstructed. B. Apply oxygen to keep his oxygen saturation over 94%. C. Administer dobutamine to increase cardiac output. D. Statin 4 for monitoring of intake. Correct answer, A. Ensure his airway is open and unobstructed. Although all of these interventions are important for a patient with heart failure, an open and unobstructed airway is always the most important intervention if the patient has a palpable pulse. 36. You are caring for a 20-year-old patient with pericarditis. What is the likely cause of pericarditis in a young patient? A. Heart failure. B. Acute MI. C. Hypertension. D. Infectious processes. Correct answer, D. Infectious processes. In younger patients, pericarditis is typically caused by an infection commonly caused by Coxsackie virus, Streptococcus, Staphylococcus, or Haemophilus influenza. In older adults, the most common cause is AMI. 37. Your patient has been diagnosed with acute bronchitis. You should expect that all of the following will be ordered except A. Increased fluid intake. B. Cough medications. C. Antibiotics. D. Use of a vaporizer. Correct answer, C. Antibiotics. Unless the patient has a secondary infection, antibiotics will typically not be ordered. It is important to obtain a chest X-ray to be sure the patient does not have pneumonia since the symptoms can be similar. Increasing fluids and use of a vaporizer will help liquefy secretions. 38. You are caring for an asthmatic patient with an early phase reaction. Which of the following is indicative of an early phase reaction? A. Rapid bronchospasms. B. Inflammatory epithelial lesions. C. Increased secretions. D. Increased mucosal edema. Correct answer, rapid bronchospasms. Rapid bronchospasms are a symptom of an early phase reaction in an asthmatic patient. The other symptoms are indicative of late phase reactions. 39. Clinical manifestations of asthma include decreased expiratory time. B. Increased peak expiratory flow. C. Increased use of accessory muscles. D. Increased oxygen saturation. Correct answer, C. Increased use of accessory muscles. Clinical manifestations of asthma include increased use of accessory muscles, increased expiratory time, decreased peak expiratory flow, and decreased oxygen saturation. 40. What drives respiration in a patient with advanced chronic respiratory failure? A. Hypoxemia. B. Hypocapnia. C. Hypercapnia. D. None of the above. Correct answer, A. Hypoxemia. In normal people, increased carbon dioxide levels provide the drive for respirations. However, in advanced chronic respiratory disease, carbon dioxide levels no longer provide the respiratory drive. Instead, hypoxia, or low blood oxygen, drive the respiratory effort. 41. Which of the following is not a warning sign that compensatory mechanisms in a patient in shock are failing? A. Increasing heart rate above normal for the patient's age. B. Absent peripheral pulses. C. Decreasing level of consciousness. D. Increasing blood pressure. Correct answer, D. Increasing blood pressure. As compensatory mechanisms begin to fail, systolic blood pressure will begin to decrease. Hypotension is a late and very ominous sign for the patient in shock. 42. How does shock usually progress? A. Compensated to hypotensive shock in hours and hypotensive shock to cardiac arrest in minutes. B. Compensated to hypotensive shock in minutes and hypotensive shock to cardiac arrest in hours. C. Hypotensive to compensated shock in hours and compensated shock to cardiac arrest in minutes. D. Hypotensive to compensated shock in minutes and compensated shock to cardiac arrest in hours. Correct answer, compensated to hypotensive shock in hours and hypotensive shock to cardiac arrest in minutes. It is critical to recognize the patient in compensated shock because you still have time to intervene before the shock state decompensates into hypotensive shock. Once the patient is in hypotensive shock, he will quickly decompensate into cardiac arrest without very aggressive treatment. 43. Patients who cannot move in their bed on their own should be turned at least underscore. A. Once a day. B. Twice a day. C. Every 2 hours. D. Every 4 hours. Correct answer, C. Every 2 hours. Patients and residents who cannot freely move about in bed must be turned at least every 2 hours in order to prevent pressure ulcers and skin breakdown. Some need even more frequent turning. For example, a patient who is incontinent of urine must be cleaned, dried, and turned more often. 44. Cheryl M. has a serious swallowing disorder. She has asked you for a glass of water. The doctor has ordered honey thickness fluids for her. Water is not a honey thickness fluid. It is much thinner. What should you do? A. Tell the resident that she cannot have water. B. Give her applesauce instead of the water. C. Tell Cheryl that she is NPO until midnight. D. Thicken the water and give it to her. Correct answer, D. Thicken the water and give it to her. You can give Cheryl the water that she has requested, however, you must thicken it with a commercial thickener before giving it to her. 45. You have been asked to record the amount of food that the person has eaten during each meal. What kinds of words or numbers would you use to record this food intake? A. A little, a moderate amount, or all of the meal. B. 50 cubic centimeters, 100 cubic centimeters, or 500 cubic centimeters of the meal. C. 25%, 50%, or 100% of the meal. D. Either or C. Correct answer, C. 25%, 50%, or 100% of the meal. Food intake is measured in terms of the percent symbol of food that has been eaten. For example, you would record 25% of the vegetable if the patient has eaten about 1/4 of the vegetables on the plate. The terms little and moderate are too vague and not specific enough. Fluids, not solid foods, are measured in terms of cc 46. Mr. Thomas is a well-groomed 68-year-old male patient. He had prostate surgery 2 days ago. He has an indwelling catheter and a urinary drainage bag. You have weighed him at 9 a.m. each morning for 3 mornings in a row. Today, on the fourth day, his morning weight is 3 pounds more than it was the day before. Why could he have gained these 3 pounds in one day, on a 1,000-calorie diet? A. It is obvious that his visitors have been sneaking him junk food from the local fast food restaurant. B. It may be that his urinary drainage bag was not emptied today and it was emptied on previous days. C. It is obvious that the scale is broken and it should be replaced immediately to prevent these false weights. D. A 3-pound weight gain is not significant enough to question and should just be noted. Correct answer, B. It may be that his urinary drainage bag was not emptied today and it was emptied on previous days. It is very possible that the urinary drainage bag was emptied on previous days and not emptied today. This very often happens. Nothing is obvious. Everything should be explored and looked into. 47. The nurse is providing teaching instructions to a group of clients who will have planned orthopedic surgeries next week. She is reviewing methods to reduce the compression of leg veins postoperatively when a client voices concerns of blood clots. Which of the following statements by the client would indicate the need for further teaching? A. I should avoid crossing my legs. B. I should sit for long periods of time so I can rest after my surgery. C. I should place a pillow behind my knee. D. I should avoid restrictive clothing in my legs. Correct answer, B. I should sit for long periods of time so I can rest after my surgery. A client should avoid sitting for long periods of time to help reduce the compression of leg veins, which is a common location where thrombi are formed. The patient does indeed want to avoid crossing their legs, avoid sitting for long periods of time, avoid restrictive clothing on their legs, and should place a pillow behind the knee. 48. A nurse is assessing a client diagnosed with a substance use disorder in preparation to be discharged from a rehabilitation facility. Which of the following would be the most effective support system in preventing relapse? A. Family. B. Narcotics Anonymous, NCLEX/Alcoholic Anonymous, AA meetings. C. Friends. D. All of the above. Correct answer, B. Narcotics Anonymous, NA/Alcoholic Anonymous, AA meetings. NA/AA meetings would be the most effective support system in preventing relapse in a client who has a substance use disorder. NA/AA meetings require clients to work through a 12-step program to achieve and maintain sobriety. 49. Which of the following is an example of an opioid? A. Mescaline. B. Diazepam. C. Phenobarbital. D. Methadone. Correct answer, D. Methadone. Opioids are a type of drug classified as narcotics. Opioids may be one category of drug that nurses see when working with clients with substance abuse. Examples of opioids that may cause addiction among some clients include methadone, codeine, morphine, or hydromorphone. 50. A client comes into the emergency room and asks to see a doctor. He is anxious, visibly upset, and keeps looking behind him to the waiting room. When the nurse asks his chief complaint, he says, "My roommate is trying to kill me." Which of the following is the most appropriate initial response of the nurse? A. Just wait here and I will notify security. B. I'm going to speak with the physician about getting some medication that may help you. C. Why is your roommate trying to kill you? D. Have you called the police to report this? Correct answer, C. Why is your roommate trying to kill you? Upon initial assessment of a client who appears anxious and overstimulated and who presents with questionable claims, the nurse should initially try to gain more information about the situation. It is possible that this client's roommate is actually trying to kill him, or he could have a mental health disorder causing him to think inappropriately. It is the nurse's responsibility to gather more information to determine what is true in this situation. 51. A 17-year-old Asian client is being seen for lower abdominal pain in the right quadrant. The client is accompanied by his parents. The nurse notes that the client's father does not make eye contact and shows little response when told that the client will need surgery. Which of the following is the most appropriate action of the nurse? A. Contact an interpreter to give the information again in the father's native language. B. Continue to provide information about surgery to both the client and his parents. C. Call social services to evaluate the parent's standard of care. D. Contact the physician about postponing the surgery. Correct answer: B. Continue to provide information about surgery to both the client and his parents. Nurses may work with clients who have varying cultural beliefs. Because of this, nurses must remain aware of the cultural practices associated with certain ethnic groups. Asian Americans may avoid eye contact as a sign of respect. Additionally, emotional responses may be avoided except for in private situations. If this family did not have a language barrier, the nurse should continue to provide appropriate information about the surgery and recognize the cultural differences that exist. 52. Which of the following best describes eye movement desensitization and reprocessing, EMDR? A. A client follows the nurse's finger with his eyes until he reaches a hypnotic state. B. A client reads a story about a traumatic event and then visualizes the result. C. A client focuses on a negative thought in his mind while moving his eyes back and forth. D. None of the above. Correct answer: C. A client focuses on a negative thought in his mind while moving his eyes back and forth. Eye movement desensitization and reprocessing, EMDR, is a form of therapy used for dealing with negative thoughts or traumatic memories. It may be used among clients with post-traumatic stress disorder. A client who undergoes EMDR focuses on a negative thought or memory and the feelings associated with it while simultaneously moving the eyes back and forth. Eye movement may be through following an object or receiving tactile or auditory stimulation. The EMDR process is not the same as hypnosis as a form of treatment. 53. Which of the following is an example of neurofeedback used with a child diagnosed with reactive attachment disorder, RAD? A. Parents or a nurse hold a child close during play until he becomes angry enough to unleash his rage. B. Parents give their child a sticker when he behaves appropriately. C. A child uses a sand tray to draw shapes and to release stress while talking with a nurse. D. A child's brain waves are monitored through electrodes placed on the scalp. Correct answer: D. A. Child's brain waves are monitored through electrodes placed on the scalp. Neurofeedback is a form of treatment that may be used for children diagnosed with reactive attachment disorder, RAD. Neurofeedback involves attaching electrodes to the scalp in a method similar to an EEG. The child's brainwaves are then monitored while he is exposed to positive images or games in order to produce positive brain patterns. 54. A nurse is using therapeutic techniques to help a client who is having difficulty applying for a job because of panic and anxiety. The nurse pretends to be the job supervisor while the client practices answering questions during an imaginary interview. This technique is an example of A. Reinforcement. B. Presenting reality. C. Role-playing. D. Summarizing. Correct answer: C. Role-playing. Role-playing involves practicing appropriate behaviors during imaginary scenarios that would be similar to what the client will experience. Role-playing allows the client to prepare how he would act or what he would say if the situation were real. This technique is useful for clients who feel paralyzed by feelings or thoughts that cause inaction. 55. Which of the following actions of the nurse is most appropriate when working with a client who is extremely angry? A. Place a light hand on the client's shoulder to imply understanding. B. Maintain close proximity to convey trust. C. Temporarily change the subject if the client's behavior is changing. D. Close the door to the room to provide privacy. Correct answer: C. Temporarily change the subject if the client's behavior is changing. A nurse who is working with a client that is angry can employ several techniques that may be calming or will keep her safe while providing care. If the client's behavior starts to escalate or he begins to fixate on a subject that makes him angry, the nurse can temporarily change the subject as a method of distraction from the original idea. 56. Which of the following is an advantage of working with psychiatric clients in a group setting? A. Clients assist each other through therapeutic interventions without a need for a nurse. B. Clients can behave however they wish while knowing the group will not lead to long-term contact with others. C. Clients can remain anonymous in sharing private information without the legal constraints of reporting illegal activities. D. Clients learn from others when their behaviors are inappropriate in a safe and trusting environment. Correct answer: D. Clients learn from others when their behaviors are inappropriate in a safe and trusting environment. Group therapy may be used in some mental health treatment situations. Placing clients together in groups may help individuals to express thoughts and feelings without being judged or criticized for their behavior. Clients who work in groups can learn from others in the group about inappropriate behaviors because group members may share some of the same struggles. Groups are often meant to be trustworthy to encourage clients to open up. 57. A nurse is caring for a client who is having blood tests and who has an elevated lymphocyte level. Based on knowledge of cellular components, the nurse knows that these cells, A. Contain histamine and provide protection during allergic reactions. B. Are involved in phagocytosis. C. Provide protection and immunity against foreign substances. D. Carry hemoglobin and oxygen to body tissues. Correct answer: C. Provide protection and immunity against foreign substances. Lymphocytes are types of white blood cells that work to support the body's immune system. These cells produce substances that protect the body against infection and foreign substances that can make a client ill. Two types of lymphocytes are T cells, produced in the thymus, and B cells, produced in the lymph tissue. 58. Mr. Y had surgery 2 days ago and is recovering on the surgical unit of the hospital. Just before lunch, he developed chest pain and difficulties with breathing. His respiratory rate is 32/minute, his temperature is 100.8, and he has RALs on auscultation. Which of the following nursing interventions is most appropriate in this situation? A. Place the client in the Trendelenburg position. B. Contact the physician for an order or antibiotics. C. Administer oxygen therapy. D. Decrease his FOR rate. Correct answer: C. Administer oxygen therapy. Chest pain, dyspnea, tachypnea, mild fever, and RALs or crackles on auscultation in a client who had surgery 2 days ago may be indicative of a pulmonary embolism. The nurse should administer oxygen to address his breathing and assist him to a comfortable position to facilitate better oxygenation before contacting the physician. 59. A client returns from surgery after having a colon resection. The nurse is performing his assessment and notes the wound edges have separated. This condition is called A. Evisceration. B. Hematoma. C. Dehiscence. D. Granulation. Correct answer: C. Dehiscence. Wound dehiscence occurs when the edges of a wound pull apart. The condition may occur following a surgical procedure if the sutures were deficient. Wound dehiscence may also occur following a wound infection or in cases where a client significantly stretches or overuses the associated tissues. 60. Mobility is an important human function. The hazards of immobility lead to many physical problems and emotional problems. Immobility can lead to detrimental cardiac, muscular, respiratory, skeletal, urinary, gastrointestinal, skin and emotional changes. Which of the following is an example of a skeletal hazard of immobility? A. Contractures. B. Constipation. C. Calcium loss. D. Catabolism. Correct answer: C. Calcium loss. All of the above choices are hazards of immobility. However, only the calcium loss from the bones is a skeletal system impairment that results from immobility. 61. which is a physical, integumentary risk among the elderly population? A. Skin tears. B. Thickened skin. C. Thinning toenails. D. Less nasal hair. Correct answer: skin tears. Skin tears are a physical, integumentary, skin risk among the elderly population. The skin thins and becomes more fragile. Toenails thicken and nasal hair becomes thicker. 62. You are turning your patient in bed and you see that this confused and lethargic patient had loose car keys and lipstick in the bed and had been lying on them. What is this person at risk for because of all three of these factors: the confusion, lethargy, and items in the bed? A. Falls. B. Skin breakdown. C. Apnea. D. Lack of mobility. Correct answer: B. Skin breakdown. This patient is at great risk for skin breakdown because this patient has three risk factors associated with skin breakdown. These three risk factors are confusion, lethargy, and the presence of items in the bed. This patient is at risk for falls because of the confusion. The person is at risk for a lack of mobility because of the confusion and lethargy, but only skin breakdown is associated with all three of these risk factors. 63. One of the complications of complete bed rest and immobility is which of the following? A. Plantar flexion. B. Dorsal flexion. C. Extension contractures. D. Adduction contractures. Correct answer: A. Plantar flexion. Plantar flexion, or foot drop, is a complication of complete bed rest and immobility. Dorsiflexion is when you move your foot upwards. Contractures can also occur as a complication of complete bed rest and immobility. However, these contractions are flexion, not extension or adduction contractures. 64. Plantar flexion can be prevented with underscore. A. Foot soaks. B. Foot boards. C. Toenail care. D. Proper shoes. Correct answer: B. Foot boards. Plantar flexion, or foot drop, can be prevented with foot boards, special splints, and range of motion exercises. 65. The smallest of the white blood cells which also can be involved in humoral immunity is the A. Lymphocyte. B. Monocyte. C. Basophil. D. Erythrocyte. Correct answer: A. Lymphocyte. The smallest of the white blood cells is the lymphocyte. Monocytes are the largest white blood cells. 66. A nurse is treating a client with suspected carbon monoxide poisoning. Which of the following symptoms are associated with this condition? A. Red rash across the trunk and extremities. B. Nausea, vomiting, seizures. C. Flushing of the face and neck. D. Abdominal pain radiating to the back. Correct answer: B. Nausea, vomiting, seizures. A client with carbon monoxide poisoning may present with nausea, vomiting, muscle weakness, or lightheadedness. Untreated, the condition may lead to seizures, coma, or death. Carbon monoxide toxicity is a safety risk because it is a colorless and odorless gas. Many people exposed to carbon monoxide may be unaware of toxic levels that can cause serious illness. 67. A nurse attempts to plug in a sequential compression device when she notices a tingling sensation in her hands while touching the cord. What is the next action of the nurse? A. Attempt to plug the device into a different outlet. B. Inspect the cord for damage. If none is present, continue to use the device. C. Discontinue the device and send it to the maintenance department for inspection. D. Notify the supervisor that the unit is at risk of an electrical fire. Correct answer: C. Discontinue the device and send it to the maintenance department for inspection. Signs that electrical equipment is not working properly and may increase the risk for damage or fire include the feeling of current in the cord, which may manifest as a tingling sensation. Electrical equipment that is malfunctioning should be discontinued and thoroughly checked by maintenance or an electrician before use. 68. A client has become combative and is attempting to pull out his fore and take off his surgical dressings. The nurse receives an order to apply wrist restraints. Which action of the nurse signifies that restraints are being used safely? A. The nurse ties the restraints in a square knot to prevent the client from untying them. B. The restraints are attached to a movable portion of the bed. C. The padded side of the restraint is applied next to the skin of the wrist. D. The nurse assessed the client's distal circulation every 24 hours. Correct answer: C. The padded side of the restraint is applied next to the skin of the wrist. Restraint use must be governed for the safety of the client. Restraints applied around the wrists should be placed so that the padded side of the restraint is against the skin, which may help to prevent skin breakdown. Restraints should be applied in knots that are quick release in case of emergency. 69. An attack using microorganisms such as bacteria or viral agents with intent to harm others is called A. Assimilation. B. A defense intervention. C. Bioterrorism. D. Environmental remediation. Correct answer: C. Bioterrorism. Bioterrorism involves using harmful agents such as bacteria or viruses with the intent to harm others. Nurses may be involved in disaster response if weapons using bioterrorism affect the community. 70. All of the following factors may contribute to client falls except contact dermatitis. B. Urinary frequency. C. Decreased visual acuity. D. Confusion. Correct answer: A. Contact dermatitis. Risks for falling may be due to intrinsic factors, such as health conditions, or external factors, such as environmental circumstances that place certain clients at risk. Some examples of factors that may contribute to client falls include urinary frequency, requiring an increase in trips to the bathroom, decreased visual acuity, and confusion. 71. A small fire has erupted in a wastebasket in the client waiting room. Which of the following is the first action of the nurse? A. Call 911. B. Find the fire extinguisher. C. Move clients to safety. D. Throw water on the fire. Correct answer: C. Move clients to safety. When a fire starts in a healthcare setting, the first action of the nurse is to move clients and anyone who may be in danger to a safe setting. Small fires may be contained through a fire extinguisher, but client safety is a top priority. 72. A nurse is assisting a client with ambulation in the hallway. The nurse is using a gait belt for further assistance. The client becomes dizzy and starts to faint while walking. What is the first action of the nurse? A. Stand behind the client and prepare to catch him when he falls. B. Assist the client to sit in the nearest chair or slide down along a wall. C. Grasp the client under the arms and pull him upward. D. Call for help from nearby staff. Correct answer: B. Assist the client to sit in the nearest chair or slide down along a wall. If a nurse is assisting a client with ambulation and he starts to faint or fall, the nurse should assist the client into a sitting position in order to reduce the impact of the fall. This may mean lowering the client into a nearby chair. If a chair is not available, assist the client to lean against the wall. Using the wall for support, help him slide to the floor. Case Study 4. A 62-year-old male client presents to the emergency department via EMS after the wife reported that the client experienced a sudden onset of shortness of breath, chest pain, and restlessness. Upon arrival, the client is restless, reporting, "I can't breathe." Exhibit 1 Vital Signs, 2023 BP 128/66 mmHg, HR 122 BPM, RR 38 breaths/minute, pulse oximetry 92% on a non-rebreather at 15 L. 73. Which of the following actions should the nurse anticipate upon the client's arrival? Select all that apply. A. Suction the client via deep suction. B. Perform an ECG on the client. C. Place the client in a high Fowler's position. D. Instruct the client to take slow deep breaths. Correct answer, B. Perform an ECG on the client. The nurse should anticipate performing an ECG on the client. The client should be evaluated for cardiac conditions contributing to the client's symptoms. An ECG can not only rule out an MI but can also be reflective of other conditions, such as anatomical abnormalities of the heart. In addition, the client experiencing a respiratory emergency is at an increased risk of cardiac arrhythmias and should be evaluated and continuously monitored for this potential complication. The nurse should also place the client in a high Fowler's position. In this position, the client sits upright at a 90 degrees angle. This position is optimal for the client experiencing respiratory distress and allows for better lung expansion and oxygenation. Answer A is incorrect. The nurse should not provide deep suction to the client. There is no indication that the client's airway needs to be cleared with suctioning. The client can speak, and there is no mention of stridor, indicating the airway is patent. Unnecessarily suctioning the client's airway will worsen the client's anxiety and potentially exacerbate the client's hypoxia. Answer D is incorrect. The nurse should not instruct the client to attempt to control their breathing and take slow, deep breaths. Coaching on breathing and breathing exercises is inappropriate for this client's current condition. The client has unstable vital signs that are indicative of respiratory distress. The nurse knows the client needs additional ventilatory support. 74. Exhibit 2, Primary Assessment, Pre- and Post-Intubation Prior to Intubation, 2024 Neurological, GCS 14, Anxious, PERLA, Respiratory, Clear breath sounds bilaterally, Tachypnea, Labored respirations with accessory muscle use, Cardiovascular, Sinus tachycardia regular rhythm, S1 S2, skin warm and dry. Post-intubation, 2032 Neurological GCS 3, respiratory, decreased left-sided breath sounds and clear right-sided breath sounds, assisted respirations via bag valve mask ventilation, cardiovascular, sinus tachycardia regular rhythm, S1 S2, skin warm and dry. The healthcare provider arrives at the client's bedside and intubates the client after a sedative and paralytic are administered. Which of the following findings in the client's reassessment should most concern the nurse? Sinus tachycardia rhythm. B. Glasgow Coma Scale is 3. C. Decreased left-sided breath sounds. D. Skin is warm and dry. Correct answer, C. Decreased left-sided breath sounds. After intubation, it is essential to listen over the client's epigastric region to ensure the ET tube is not in the esophagus and listen to bilateral breath sounds to help confirm proper ET tube placement. The decreased breath sounds on the left side can indicate that the ET tube was advanced too far and might be in the right main stem bronchus. Due to the anatomical difference in the right main bronchus, the ET tube is more likely to follow the pathway into the right main stem than the left if it is advanced too far. Answer A is incorrect. The client was in a sinus tachycardia rhythm before the intubation. Immediately following the intubation, the client is not expected to be in a sinus rhythm. The cardiovascular response was to increase the heart rate to attempt to deliver more oxygen to the tissues and organs. Sinus tachycardia is still expected, and the heart rate should gradually decrease as perfusion improves. A more concerning sign would be sinus bradycardia, which would indicate a lack of compensation and would be concerning for an impending cardiac arrest. Answer B is incorrect. A GCS of 3 is expected in this client. The client was sedated, and a paralytic was administered. Therefore, it would be expected for the client to be unable to respond or move, which is the desired effect and allows the healthcare provider to intubate the client successfully. Answer D is incorrect. Warm and dry skin is an expected finding. It would also not be uncommon for the client who is experiencing a respiratory emergency to be diaphoretic, which would be an abnormal finding and can accompany hemodynamic instability. 75. Which of the following information regarding the client's history obtained from the wife is most significant regarding the client's current condition? A. Last night, the client took a bath before bed. B. The last time the client ate was this afternoon. C. 3 days ago, the client flew home from a business trip. D. The client drinks an alcoholic drink or two at social events. Correct answer, C. 3 days ago, the client flew home from a business trip. The information provided by the wife regarding the client recently flying home from a business trip is most significant. Immobility increases the risk of a thrombus forming. If the client had a deep vein thrombosis, DVT, form, there is a possibility that the thrombus then traveled to the lungs, and the client might be experiencing a pulmonary embolism. Answer A is incorrect. The client taking a bath before bed is insignificant information provided by the wife. The client taking a bath the night before does not predispose him to any condition that would concern the nurse. Immobility, occurring on a long trip such as flying, is concerning because of the increased risk of clot formation. Answer B is incorrect. The last time the client ate is important because it increases the risk of vomiting. However, the client's airway is already secured via an ET tube. Answer D is incorrect. The client's reported alcohol use is not a significant finding in relation to the client's current condition. For adults who choose to drink, the recommendation for alcohol intake is no more than 2 drinks per day for men and no more than 1 drink per day for women. An excess amount of alcohol use can increase the risk of stroke, cancer, and other medical conditions. However, the wife reports the client's alcohol intake is less than the recommended alcohol intake for male adults. Congratulations! You have completed the test. Don't forget to like this video and subscribe to our channel for more resources.